We're going to talk about all things Social Security and particularly how they've been, let's say, not telling us the truth for several decades. And what are we talking about here? The fact that they've been mentioning for several decades that the Social Security Administration is going to be cutting benefits in the future, which, according to the Social Security Trustees report, is a fact. The Social Security just came out with a trustees report about a week or so ago, and it said probably in 2033, 2034, we're going to get a cut of benefits about 19 to 23%. And that is a reality. And there's no grandfathering in. Everybody always says, well, it doesn't matter to me. I'm currently receiving benefits, so it's not going to affect me. No, unfortunately, the Social Security, how it works is that there is X amount coming in, and if there's not a trust fund, which there is a trust fund right now, if that trust fund runs out, then everybody's benefits going to get cut because they can only pay out what they get coming in that particular year. So people that are currently working, paying FICA taxes, that's what pays predominantly in the future is going to be, that's what's going to pay 80% of your check. Right now, that gap is being paid for by the trust fund. Every month, every year, they take money out of the trust fund and put it in your checks. So it wasn't stolen or anything like that. And the lie, the incorrect truth, the incorrect truth, that they've been telling us for decades is it's our fault. Is that we're living longer and we didn't have enough babies. So it's demographics. It's all 100% our fault. As Steve Martin used to say back in the 70s, well, excuse me for living longer than you anticipated. Sorry to mess up your demographic calculations, but yes, people are living longer. But is that the reason Social Security is going to get a cut in the future? Not necessarily, because people live longer, they're also working longer, so they're paying into Social Security longer. Okay, so that's not necessarily an issue. And the fact that people didn't have enough kids, and therefore the ratios, there's, few people working now and there's a lot of people retiring and stuff. So it's all our fault for not having as many kids. Okay. So let's say we doubled our population, then everything should be good, right? Well, here's the truth of the situation. Let me pop up a couple of charts here, and I don't want to get too deep into the weeds. But the reality is that it's not necessarily the fact that, trying to find my charts here, hold on one second. It's not necessarily the fact that we don't have enough people. The reality is that the people that are working aren't getting the wages they should be getting. Here's the situation. So this bottom line here, this blue line is our wages. Since basically the 1980s, our wages have been stagnant. So since the 1980s, adjusted for inflation, our wages really haven't increased that much. Obviously, everything else has increased substantially, particularly healthcare. But you see this other top line up here, that is productivity. So we are working our butts off. We are producing so much more since the 1980s. But we don't get that money. We work, we produce more and more and more widgets every single year. Productivity goes up, what we produce goes up, but our wages stay the same. Where did all that money go to? Well, we know where that money is going to, and we know even more, they're taking a vote on the big billionaire bill right now, and more of that money is going to go to the this bottom chart right here. So this is the concentration of income in the United States since the 1980s. So we produce more, we don't get the benefits of that. It goes to the top 10%. So if the people that actually worked got the money that they actually produced, got a bit of the money that they produced, then what would be paid into Social Security would have doubled, about 107%. So more than doubled what we paid into Social Security, and that would keep Social Security alive for decades and decades and decades. And this is pretty much what they calculated when they started all this. When they raised the retirement in the 1980s, about 1983, they raised the retirement age. They did the windfall elimination provision. They did a bunch of things. They started building up the trust fund, and they said, based on everything we did in 1983, all of those changes, raising the retirement age and all that stuff, we anticipate that Social Security will be good for 75 years. They always do 70, 75 years, projections in the future. So Social Security should be good. It should pay 100% of people's benefits up until at least 1950. But that's not how it worked out, because, they knew people are living longer. They knew demographics. They knew people were having less kids and stuff like that. But what they didn't anticipate was the fact that, the money that we produced was going to the top. And those that are regular viewers to my channel know that if you make over $176,100, you no longer pay into Social Security. If you make under that, you pay every penny, every dollar you make. You have to pay 6.2% into Social Security, 1.45% into Medicare. But if you make over $176,100, you are now exempt from paying the Social Security part of FICA. And that's the issue. If we would have gotten that money from what we produced, then Social Security would be good for decades and decades and decades. But that money wasn't coming to us. It was going to the hire. So when people say, yeah, we need to raise the retirement age again because you guys are living too long and you're not having enough kids and all the rest of it, you just tell them that's BS. That's BS. That's not the reason Social Security is going to be getting cuts here in a few years. The reason is that we're not getting what we earned, we produced. So the most important thing is to make sure you reach out to your politicians. Obviously, they aren't listening right now because they are in the process of cutting Medicaid for millions of people, cutting health care for millions of people. And also, on the back end, they're going to be cutting Medicare for millions of people because of what's called sequestration. When they cause a deficit like this, and the current politicians up there, supporting this, they're saying, no, it doesn't cost a deficit. It doesn't cost a deficit. It is budget neutral. Okay, then why do you need to raise the debt ceiling by $4 or $5 trillion? Riddle me that, Batman. So none of this makes sense. And they're saying, we're not cutting Medicaid. But then they make out a special carve out for Lisa Murkowski out of Alaska saying, hey, if you give us our vote, we'll make sure we protect your Medicaid in your particular state. The other 49 states, forget about them, like Louisiana. We just got news that hospitals throughout Louisiana sent Mike Johnson a please, if this big billionaire bill passes, it is going to devastate health insurance in Louisiana for millions of people, not only for those people who receive a Medicaid, but because particularly rural hospitals get Medicaid money, they are going to be in dire straits and everybody's going to lose out. So hospitals sent to Mike Johnson and said, hey, this is terrible. What are you doing? You're killing us here. And obviously, they don't care because they're bought and paid for by Wall Street and the billionaires, and that's who funds their campaigns. And as Mitch McConnell says, hey, y'all are get over it. So I guess we just have to get over it. And but a lot regular viewers to my channel ain't getting over it. We are going to fight to make sure this doesn't happen. And if it does, then we're still going to fight to make sure it's fixed, right? All right, let's get into the live Q&A right now. I already got a bunch of questions. If you're new to my channel, this is how I do it. I come up with a topic of the day, and then I answer questions for the remaining, I guess we're at about 50 minutes now or so. Let's see. Bella, hey, Bella, how we doing today? You have baby boomers era, retirement era now, a huge influx of claims. Yes, and that's one of the other problems, one of the other ways that the billionaire class wants Social Security. They want that $2.7 trillion in trust funds. They want, the $1.2 $2 trillion or so that comes in a FICA tax. They want that money so they can gamble on it. So they have done several things over the last few decades. One of the things is they destroyed customer service at the Social Security. Even before Doge and Elon Musk, Social Security had the worst in terms of staffing in over 50 years. And now it's even worse. Once thousands of people got summarily vacated from the premises. If wages were higher, workers would be paying more into Social Security. Exactly. So you can do it one or two ways. You can say, okay, we all should have had twice as many children. So instead of, let's say, 100 million people working, we would have had 200 million people working. Okay, that would have solved it. Okay, but we didn't. Decided not to, whatever the case may be. Or you can give the 100 million people basically twice the income, which they have increased productivity since the 1980s, so they're entitled to twice the income. And then that would have solved it as well. So it's like having 200 million people, but only 100 million people, but twice the pay. But that's not what they decided to do. They decided to give, more and more money to the wealthy, and eventually it was going to trickle down. And that's been basically the story since the 1980s. And I don't know about y'all, but and I haven't seen any trickle down. So, and now we're doing the same thing. What's the definition of stupidity? Stupidity is doing the same thing, expecting a different result. We've given out trillions of dollars of tax cuts over the last 20 years. The Bush tax cuts, several tax cuts, massive trillion-dollar tax cuts. We've done that several times, and there's still millions, tens of millions of people out there struggling. So we're going to try it one more time to see if it works this time. Take money from the lottery from schools, share the wealth there. Take money from the lottery. Yeah, I think a lot of the lotteries throughout the country, but that's a poor person's tax. Yeah, all the studies that show that, that's a poor person tax. So $5,000 support a child, doesn't support a child. What do they do after the $5,000 is gone? Yes, I like your young Frankenstein little thing there. Ed, you are doing a tremendous service to us all. Thank you, appreciate it. Let's see. I tried to get hold of my representative. He doesn't even want to talk to me about Social Security. Of course, he's a GOP, so he doesn't care about it anyway. Yeah, and I always try to avoid saying the R's and the D's and all that, but, everybody knows, what parties are responsible. But I would argue they both are, because we've known about the future cuts of Social Security. We've known that everything is going the wrong way. We've known about that for decades, and it's not fixed. And sometimes one particular party's in charge, and sometimes the other political party's in charge, and neither of those times was the issue fixed. So it's, both of those. You are truly an expert in SSA. I appreciate it. That's what you get for taking hundreds of thousands of claims from all things Social Security. All right, let's see here. Someone says, yeah, blue states need to separate. They don't care. Yeah. Jeffrey, hey, Jeffrey, the money has never gone to the workers. It's always gone to the top, if you will. Yeah, that's been shown by every analysis, every economist that shows, wages, the chart I just showed. That's from the Federal Reserve out of St. Louis. That chart, those statistics, and it showed that wages for the majority of has been stagnant. But the people that are making money, they are making phenomenal amounts of money. And I want to differentiate one. There's super earners and super investors. Scott Galloway's done some great stuff on this. He talks about this as well. But if his example is really good. He talks about it like a chiropractor. If you're a chiropractor and you're, a doctor, whatever, physical therapist or whatever, and you're working your butt off and you're making really good money, $200,000-$300,000 a year, you're paying, a lot of tax, particularly if you're on a particular state that, has state taxes and all that, you're paying a lot of taxes. But if you then say, okay, I'm a physical therapist and I have my own business and I do that, but then I want to invest and I want to buy another business and another business and another business and you become an investor, then you can manipulate it around where, one day you were paying 40% tax and the next day you're paying, maybe 6% tax or something. So it's that middle class, the upper middle class that's paying the taxes. The really rich are, not so much. And they're definitely not paying Social Security tax, like we are. It's been the longest ripoff of our money because of where the money is going. Yeah, it's definitely not, still not trickling down. Contacted Social Security regular extra on my Social Security from Hub and divorced. Now married, 20 to 25, 76 in October. Was told don't need to do anything. If I need I wait 2 years to file. Okay. So yeah, it's hard to follow. And these longer questions like this, if it's too difficult for you to go ahead and, write it in this live Q&A, make sure I've got a couple of questions already on my website. You can go into my website, and on the bottom left, you can't see it here, but on the bottom left of my website, it has a little camera icon, and you press that little camera icon, and then you can record a question that you have. And so if you've got a little bit more deeper question, it looks like we've got about 2 questions today, so I'll answer those. All right. Can't even get disability for my husband since his stroke. No help from any services. Hospitals is for illegals. We have to go to another city to get health care. Yeah. So if your husband has had a stroke and y'all applied for disability benefits, you have to make sure you do it immediately because there is unfortunately, before Doge came in, they used to say it's about a 6 to 9 months, but all bets are off on how long it's going to take to get your disability approved because they just don't have the staff. But if you were denied disability, he was denied disability, make sure you appeal. Always, always appeal. There's usually better chances of getting disability approved after you've appealed it. So, and in terms of getting health care, yeah, once you're on disability, if you're approved for SSDI, Social Security Disability Insurance, your Medicare automatically kicks in after 24 months. So make sure you check out that. So if he had let's say if he had a stroke 2 years ago and unable to work for the last couple of years, and then you filed and you were finally approved and they go back 2 years, then your Medicare starts immediately. A lot of people miss that. They think that, well, once I get my first check, even if it's a lump sum, when I get my first check, I have to wait 2 years from that. No, not necessarily. If they approve you for disability and they approve you for a year earlier and they give you a year's of back pay, that means you've already waited the 12 months. So I've had people say, yeah, I was just approved. They gave me a big lump sum. Now I have to wait for 2 years to get Medicare. So I think I'm going to go out there and buy some Medicare. I'll go out there and buy some health insurance and yada, yada, yada. I'm like, wait a second, wait. When did they approve you? Well, they approved me effective, 2023. Well, your Medicare card's coming in the mail. So hold on. Don't go out there and spend money, waste money because your Medicare card's coming in the mail. So I finally have a phone appointment. I called them in June 18th and now talked to my local office, August 22nd phone appointment. Thank you so much for your help. You're welcome, Wild One. All right. So on this, you called them in June and you don't have your appointment until August. So you have what's called protective filing for June. So when you talk to them in August and say, hey, I want to file for, retirement benefits or spouse benefits or surviving spouse benefits or whatever you're filing for, and you actually wanted your benefits to start in June, you can start them in June. You can say, hey, I know it's August 22nd, but I wanted to start my benefits in June. That's why I called you up. And because you called them in June and they have that, what's called a lead in MCS, inside information there, that you're protected. So you just tell them, yep, start my benefits in June. And remember, if you start your benefits in June, you won't get your check until July. Remember, the June check comes in July, the July check comes in August, and all the rest of it. So, um, let's see. Not to mention nursing homes. Yes, that is going to be a big one. Medicaid, people think that, they're focusing on, knocking people off of Medicaid, their 26-year-old living in the basement playing, Nintendo. No, it's when you cut the budget like that for all these states, that's why all these hospitals are reaching out to Mike Johnson and, the representative from the congressperson from Louisiana. They're saying, you're killing us here, but he doesn't care because, the poor, they vote, but they also, if you got enough money, you can essentially buy the vote with publicity. And since Citizens United, money is speech. So, yeah, the nursing homes are going to have a very, very tough time because of I think 2/3 of people in nursing homes are receiving Medicaid because once you're in a nursing home for a while, you move into a nursing home and it takes all your 401k, it takes all your savings. And then once you run out of savings and run out of everything, resources, then Medicaid will come in and start taking care and paying for the nursing home. So there's a lot of people in nursing homes right now that are dependent on Medicaid. And if that starts getting cut back, you're going to see fewer and fewer nursing homes getting into the business and helping people out. And then, obviously the service in those nursing homes is just going to go terrible. It's, one person taking care of 5 people one day and then they start all the cutbacks. You're only going to have one person taking care of 10 or 20 people. This is not going to be good. But I called last night for my congresswoman. How unhappy I was with the BBB. Not hard to do. Keep calling. Yes, please. That's the only thing that we can do right now is just keep calling. And if you approve it, then tell them, yeah, you're doing a great job. If not, then yeah. I'm on an overpayment schedule now. Can they still override this and take 50%? I won't survive this move. No, if you've already made the deal, you've already negotiated your overpayment. The 50% and all that, if you go onto my website, it shows overpayments, and I put a little recent policy changes. So up until March of this year, they would automatically hold let me get rid of this. They would automatically hold 10%, and then Doge came in there and said, well, we're going to hold it all. So they changed it to 100%, and then there was massive outrage, including members of my community called out, and politicians, forced Doge to, fix that. And so they went to 50%. But that's an automatic default withholding. So if you've already negotiated, they're not supposed to mess with that. But, Doge is in charge of Social Security. The new commissioner of Social Security is a Doge guy. The big balls guy, just the kid is over in Social Security now. So technically, they're not supposed to change. You negotiated. You said, hey, I can't afford 100%. I can't afford 50%. Here's how much I can afford. And if it's the new policy that took place, that started about a year ago, if you want to set up a repayment agreement, then they can set up a repayment agreement up to 60 months. Pretty easy. When I was working at Social Security a few years ago, it was a lot more difficult. You can make an overpayment repayment plan for 12 months, easy. 24 months, it took a supervisor to sign off on it. Anything over 24 months, you had to go through a big rigmarole, provide resources and incomes and your bank statements and all the rest of it. So based on an Anderson Cooper 60 Minutes expose that was done a little while ago about overpayments, they kind of got pressured and they changed that around. So now you can do up to 60 months. So hopefully you did the full 60 months and it's no interest. As of right now, they might start charging interest in the future, but if they shouldn't grandfather something like that in, so you should be good. But if they do something like that, then yeah, reach out to them and said, hey, wait a second, no. We had a deal, we negotiated $10 a month or $50 a month or $100 a month, whatever the case may be. So yeah, make sure, they shouldn't do that. But if they do, you need to fight back. Came from a large family, 8. So you helped out the Social Security Trust Fund, right? My mother had, no, you should have had 16 according to, the billionaires that blame us. So you should have had 60, your family should have 16. Anyway, my mother had stayed home with my father, had gone to work. My parents had managed back then. I can't imagine raising 6 kids on one paycheck today. Yeah. Could you imagine that? It's just, yeah. I can't imagine having 8 people in the family. Most of us can't imagine having 8 people in the family. Your parents, wow. Mike Johnson's a rhino just like the rest of the Goonies. No, I think that's, yeah. If he was, then he wouldn't be trying to pass this at all. He wouldn't be trying to cut Medicaid and Medicare and all the rest of it. So yeah, I think you're completely off base there. Phil, I'm really getting to the point of listening to feckless politicians. I'm getting tired of the news switching back and forth like the wind blows. I don't mean you, Dr. Weir. Well, unfortunately, I kind of going back and forth because I'm just following the news. One day they said they're going to do this, the next day I'm just reporting the news sometimes, and I feel like watching a tennis match. Yeah, and that's one of the intents. It's to flood the zone. So much garbage, so much BS, so much distractions, and that's the intent. They want to tire you out. It's like the old Sylvester Stallone and Rambo, win by attrition. They want to tire you out, and we just throw up your hands and say, okay, what do you want to do? Just go ahead and do it to me. And then guess what? That's exactly what they're going to do. So Tracy, work in healthcare and have watched my pay go down for 11 years straight. These cuts are still going to get worse. That is a fact. Yeah. Susan, I agree with everything you're saying, and despite the resistance, it keeps happening. Yes. I did a video on this, why we can't have nice things, and it's just, it's a policy, it's a bundle of policies that have happened over the long term, Citizens United, and the fact, the great compromise that we made when we started this whole, more perfect union, that you can have a representative from Wyoming that represents 300,000 people, a senator, has the exact same power as a senator from California that represents 20 million people. So population of California is about 40 million. You got 2 senators, 20 million people that each they represent. Wyoming, about 600,000. Yeah, just stuff like that. And just money and politics. That's where it all goes back to, money and politics. So, how soon will this affect Social Security, this bill? Social Security, it doesn't directly affect Social Security for most. So if you're receiving just Social Security benefits, it's not going to affect you. The tariffs and the inflation and all that stuff. That's we'll see what happens with COLA, but don't worry about COLA. Don't watch all those stupid social media videos about COLA, how much is going to be, because nobody knows until October. The numbers don't come out until September 30th, so we've got time. So all of the COLA videos now are just stupid speculation. But for those millions of people that are like receiving Medicaid and the Medicare Savings Program, so if you know anybody out there that's struggling to pay that $185, the Medicare Part B premium, make sure they know about this, particularly before it's gone. If you are having a hard time paying that $185, please contact your state Medicaid office. And that's one of the problems with this as well. People says, I'm not receiving Medicaid, so I don't care. I'm receiving Denali Care, or I'm receiving Medi-Cal, or I'm receiving Apple Care, or I'm receiving... No, that's Medicaid. That's just the states call it different things, and so it's throwing a lot of people off. But reach out to your state Medicaid office, whatever they call it, and then apply for Medicaid. And if you're approved at the higher levels of Medicaid, then you will be eligible for what's called the Medicare Savings Program. And they will pay for your $185. So you'll get $185 back into your check. So what does that have to do with the question you just asked? Is when people lose Medicaid because they forgot to fill out the paperwork, or they missed the date, or they forgot to check this, or they forgot to date that on the forms. And that's kind of the trick in this big, beautiful, big billionaire bill, is to, kind of push people off Medicaid by, putting up all these hurdles. When you lose Medicaid or downgraded your Medicaid, then you're going to have to pay the $185. So are people's Social Security checks going to be affected? Yes. Those people that have Medicaid and are downgraded in their Medicaid level, or they lose Medicaid, they are going to have to pay the $185. And a lot of those people are also on Medicare Advantage dual eligible plans where they have those, those grocery cards you hear about all the time. Those grocery cards do exist. It's a fact. It depends on what, area in the country you are. You can reach out to Chapter and they can see if there's one available in your area. But people throughout in Louisiana, Texas, Michigan, Florida, wherever, all throughout the country, they're receiving the $185 for, help every month to pay for their Medicare Part B. They have the Medicaid, pays a lot of their, prescription drugs and doctor's visits and all the rest of it. And they also have a Medicare Advantage that they get like a grocery card that has, $100 or $200 or $300 a month, whatever it has. And if they lose Medicaid or they're downgraded in Medicaid, they lose that too. So you've got millions of people out there are going to have to pay $185 more for that. They're going to lose their Medicare Advantage, grocery card, the $100, $200 there. They're going to have to pay a lot more for their health care. And yeah, it's just going to hurt. It's going to hurt way, 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 way too many people. And, the people that are passing this, they don't care. They just really don't care. Please explain how the big, beautiful bill affects my Medicare. I have Supplement Plan G. With the Supplement Plan G, obviously you're not receiving Medicaid, because you can't receive Medicaid and receive a Medicare Supplement Plan. So you did right doing a Medicare Supplement Plan. I always recommend checking out Medicare Supplement Plans to see if it's right for you. A lot of times it's not because people don't have the budget to pay for it. But keep your Medicare Advantage, your Medicare Supplement Plan as long as possible. But it doesn't affect yours. I know there's, if you ever watched Dr. Oz on his, TV show, you know that he recommends Medicare Advantage plans. And one of his ideas that he had a while ago was, Medicare Advantage plans were going to be the default. So we don't know. Nobody knows what's going to happen here with Medicare supplements. Hopefully they stay around. But one thing on Medicare supplements, those are regulated by the states a lot, whether in terms of whether you can get one or not. So if you have a Medicare supplement plan, remember you can change that any time of the year. So if you have a G now and your price for that G has gone up quite a bit, you might want to shop it and see if there's another G or an N or something like that you can switch to. Depending on your state, you might have to go through medical underwriting, but maybe not. So you can reach out to Chapter and say, hey, I'm paying, $160 for my G every month. Is there anything cheaper out there? And they'll check to see if there's anything available in your area, 100% free. So time to pick another country, not paying U.S. taxes to live like. Well, there's a lot of people that are doing exactly that. That's why on my website, I added an extra page on living overseas about all the details about living overseas. So you can check that out. But the U.S. tax, the IRS, it doesn't matter where you live. The U.S. taxes, you have to pay taxes. Doesn't matter where you live. So in the world. So yeah, the IRS has thought about that. Sorry. Kay from Las Vegas. Are the commercials on YouTube about death benefits, is that a scam? Those commercials that say 25,000 or 50,000 death benefits, confused. Yes. Well, okay, here's the deal. As I mentioned, Medicare supplement plans, those are regulated by the states. All insurance is regulated by the states. So whether it's car insurance or boat insurance or house insurance or, health insurance or these final expense death benefit, they're all regulated by the states. So a lot of these these burial insurance companies, they use that as kind of a tricky way to get you to call them. They say, there's a new state-approved program where you can get $25,000 to take care of funeral expenses and stuff like that. Well, every insurance company is state-approved. That's the only way they can sell it in the state, is to have the state approve it. So people call it and they think, oh, this is some state thingy that is going to take care of my loved ones if something happens to me. No, it's still a private company. Yeah, it's kind of. It's just the wording that they use to get you to call them. My son is working with a company now, because that's why we started with Chapter, because there were just so many bad actors out there, and we'll say, okay, hey, let's look for someone that people can call and they'll take care of them. They won't give them all this BS. And so we decided to do that with the burial insurance too. Most people don't need it if you've got savings and stuff like that, and to take care of everything once you pass. But there's a lot of people that do need that extra protection. It's not for you. It's obviously for those people you leave behind. So he's working with a company now, and we'll be rolling that out here soon. And you can reach out to them, and they can give you the actual real information without all the BS. So. I am 62 today. Well, happy birthday. My husband passed in March. He was receiving Social Security, including the DRCs. I have an appointment tomorrow with Social Security. I was told my survivor benefits would not include the DRCs his was receiving. True. No, that is not true. If your husband delayed retirement benefits till after his full retirement age, then he gets his benefit included the delayed retirement credits. And as a surviving spouse, you are entitled to those delayed retirement credits. So probably what happened is, when you called and scheduled an appointment, you talked to what's called a CSR, customer service representative, and they're not a specialist. So it's unfortunately a common mistake. All the CSRs in my office knew that difference. So if you'd called my office, they would have known about it, because we had training on a regular, and we had training. I know a lot of my employees, I had about 100 employees, and they're like, Ed, more training? Yes, more training. Makes everybody more efficient, and we make sure we don't give out the wrong information. And we had time to train, but now, because of all the cuts, I'm sure all of the Doge kicked out the people that had the most knowledge, and now the people that are left are barely treading water. So I know they don't have time for training. So that's why we're getting so much, unfortunately, incorrect information from Social Security. And that's exactly how the people that want to destroy Social Security, that's their plan, is to make you hate Social Security, not trust Social Security. So you just throw up your hands and say, forget about it, give it to Wall Street. But in your case, yes, you get delayed retirement credits as a surviving spouse. Delayed retirement credits do not go to living spouses. So, and people say, well, Ed, what's a delayed retirement credits? Basically, that if your full retirement age is 67, let's say your full benefit amount is $1,000 if you wait till 67. If you wait till 70, that's 3 years, 8% is added every year to that. So 3 times 8, 24. So if you wait till 70, you'll get $1,240, not $1,000. And your surviving spouse will get benefits based on that delayed retirement credits. So, all right. I think I also have it. Somebody has a question. I've got 2 or 3 questions today. So let's get into some of my video questions. I got 2 or 3. We'll watch those, and I will answer them live.
Very impressed with your credentials. I was in a common law marriage before my husband passed in August of last year. I have applied for widow benefits and supplied them with over 50 documents proving my common law marriage, and they continue to deny me. Now I'm appealing and going to the judicial branch. Do I need a lawyer?
Okay. So yes. So, well, whether you need a lawyer, let me talk about the common law marriages. So in order to get benefits off a spouse, a deceased spouse, ex-spouse or something, you had to be married 10 years, unless you were married to the person when they passed away. Then it was only 9 months. Okay, but it sounds like we're looking at about a 10-year marriage. And you can provide your marriage certificate and divorce decree to prove at least 10 years marriage. And because Social Security policy is over 20,000 pages, yes, Social Security has to abide by state laws in terms of marriage. So there is no federal marriage, it's all state, right? So if your particular state has common law marriages, they recognize common law marriages, then Social Security recognizes common law marriages. And part of those 20,000 pages of Social Security policy, I know because I've read through pretty much all of it several times over in a few decades. There is a section on there in common law marriages, and it says in Ohio or Texas or whatever, whether they do or they don't, and then in the policy it says the years, because sometimes one state has common law marriage rights, but then in later they change them and they say, okay, effective 2015, no more common law marriages and stuff. So you have to, everything has to abide by the state regulation, the state law. So if your particular state had a common law marriage right and it still existed during your 10-year period, then it sounds like you definitely had the proof that you were holding out as a husband and wife and all this other kind of stuff. You were on life insurance together and, owned a home together, whatever the case may be. Then normally they should have approved it. Normally. But again, that requires, the technical expert, and maybe the technical expert in that your particular office got kicked out by DOJ. And so now they have, not the best in there. But if you're at the third stage, the administrative law judge stage, which is the third stage, that means you filed an appeal, and then another Social Security employee checked it and determined that no, you are not, and then another checked it and they said no, you're not. It wasn't recognized. Then that's when you're going to let me see, I think I had a link on my website for common law marriages, but yeah, I do have information, but not the particular states. Oh, wait, yes, I do. Here it is. I found it. So states that, this is my website, mygovexpert.com. Common law marriages, states that recognize common law marriages as of 2025, Colorado, DC, Iowa, Kansas, Montana, Oklahoma, Rhode Island, Texas, Utah. And then some other ones recognized it before particular dates. So if hopefully you fall within those parameters. But do you need a lawyer? Number one is you're going to have to pay for it. You hear about, Social Security lawyers, but those are disability type lawyers that they will take your case and not charge you anything unless you win. And if you win, then they get 25% of back pay up to what this year is $9,200. But because this is not a disability type case, they're probably not going to take it for free. So you can hire a lawyer and pay them, whatever they're going to do, thousands of dollars, and you can hire a lawyer. But I don't think in this particular case, again, I want to step back and say, I don't want to talk bad about lawyers. I don't think they're going to be able to help you here because it's pretty cut and dry. The judge will just have to look, and you're saying, okay, we were in a common law marriage from 1980 to 1990. And the judge, all they have to do is look at the particular state and say, oh, okay, in Ohio, in those years, they did recognize common law marriages. And what does the state require in terms of documentation? Oh, that you were holding out as a husband and wife, and how, that you were portraying yourself as kind of a husband and wife, that you were married. And they say, okay, well, we need this, this, and this. So it's pretty cut and dry. So again, you can spend money on a lawyer, but I don't think a lawyer is going to help you. So it's just the judge has to look at it again. So, all right, we've got another one here.
Hi, Dr. Weir. First of all, thank you for all of the information uh, for all of us on Social Security. I have a question. I am 74 years old. I was divorced many years ago. I was married, I followed all of the rules. I was married over 10 years. When I hit my full retirement age, I filed for Social Security on my ex-husband's record and got it and did so. And I delayed my own until age 70 to get the delayed benefits. So I've been on receiving my own now with the delayed benefits. My ex-husband recently passed away. I called Social Security. The lady told me at Social Security that my ex husband was receiving the max benefits. He was a professional. And she told me the amount that he was receiving upon his death. But when she calculated my spousal benefit, it didn't add up to what he was receiving.
Okay, so it definitely sounds like the person is entitled, eligible to those benefits. They were married for 10 years, all that stuff, currently not married and everything like that, but the numbers have to work. You have the benefit from your ex, whether it's the person is still out there alive and kicking or deceased or whatever the case may be, that benefit has to be more in this particular situation. So it sounds as though because your benefit is high and you also waited for delayed retirement credits, so it's even higher than the benefits at your full retirement age. It just sounds as though, yes, you're eligible for those benefits, but there's just no extra money there because you can't get both. This is a common misconception. This is one of the worst things I had to do when I worked at Social Security was break the news to people about this. They would come in, this is predominantly a surviving spouse issue. Their surviving spouse would come into Social Security and I would, sorry for your loss and let's go ahead and get you that, that terrible lump sum death benefit, the $255. It's embarrassing, but let's also give you some surviving spouse benefits. Okay. So let's say the surviving spouse was receiving $1,000 a month from Social Security and the deceased was receiving $2,000 from Social Security. So $3,000 was coming into the house before the person passed away. $3,000, taking care of the mortgage and food and electricity. So two of you, $3,000. And then you hear that when a spouse passes away, you will receive that check. And that is correct. But it is offset by your check. So basically, you're receiving $1,000. You're eligible for that $2,000, but your $1,000 offsets that. So basically, you continue to receive your $1,000, plus you receive the difference, another $1,000, for a total of $2,000. So one day you're receiving $3,000 a month, and the next day you're only receiving $2,000 a month, or even less if you start those benefits early. So I can't tell you how many times I had to break the news and you just saw a surviving spouse, elderly surviving spouse that, was just devastated by the loss of their loved one. And then I had to be the bearer of bad news and said, yeah, sorry from now on, you're going to get $1,000 or $2,000 less coming into the house every day, every month because of how it's calculated. So we really, really need to reach out to people and let them know that that is the reality. So I am thinking, obviously, I don't know the calculations of this young lady of how much she's receiving and everything, but that sounds like the situation. If that's not the situation, then yeah, somebody messed up somewhere. So I would request an appeal. I would appeal that decision. Anytime you get an official decision from Social Security, you can appeal it. It's called a SSA 561, a request for reconsideration. And the key is it has to be an official decision. So if you call up Social Security or you go into the office or something and you're told X, Y, and Z, over the phone or, face to face, and they say, no, you can't do that. You're not eligible for that. You say, okay, that's nice, but those words coming out of your mouth are not an official decision. I want an official decision that I can appeal. You can't appeal what someone just says, at the front counter. You have to say, okay, from what I understand, from what Dr. Ed has said, you are incorrect about independently entitled divorced spouse or whatever the case may be. I want an official decision. And then they'll schedule an appointment or they'll send you in the back and to file an appeal. And then if you're denied, you'll get a letter in the mail and it'll say, if you disagree with this decision, you can file a SSA 561 within 60 days, usually 65 days. And there's tricks around the timing as well. If you miss that, the 60 years, they usually give you like a 5-day, mailing, kind of gray area. But if you miss that, you can file what's called a good cause letter and say, hey, I missed I didn't file an appeal within 60 days because I was in the hospital or I didn't get the letter or whatever the case may be. I never, ever, ever, ever denied a good cause letter for someone that said, well, the reason I didn't do it in 60 days was because of this. I'm an easy touch. So I approved every single one like that because nobody was asking for anything stupid. So I always approved those. So Sandy, I am 90 years old. In order to stay on my Social Security and Medicare, do I have to have a yearly exam by my doctor? Absolutely not. In order to make sure you're healthy, and which I'm sure you are, then it might be a good idea to check in with your doctor every year. But in terms of Social Security and Medicare, no, not at all. You're completely good. Well, you're not required. But Medicare does, if you're like in a Medicare Advantage or supplement plan, remember all that stuff, if you, whatever you have Medicare and you have a supplement or a Medicare Advantage, whatever the case may be, you prepaid for all of the help, that will afford you. So, get your, as we used to say in the Marine Corps, your preventative maintenance, go get your colonoscopy or, whatever the case may be, get all that stuff, because you paid for it, right? Obviously, in case there's any, deductibles or anything like that. So, yeah, you paid for it, but you're not required. No, you're good. I will be 62 in December. How soon can I apply for Social Security? So if you're going to be 62 in December, you have to be 62 the entire month. So if you were born basically on the 1st, then you're good. If you weren't, then they're not going to start your benefits until January. And if you start your benefits in January, your first check will come in February. But about 3 months before. So we're looking at maybe October or so. But in preparation for that, go into Social Security, ssa.gov, and set up a My Social Security account. I know it's difficult. It's a nightmare to set up an account, and it's good that it's a nightmare because it protects you. They make it as difficult as possible for you to set up an account, and that makes it almost impossible for someone else in the world to go in there and pretend to be you to set up an account. So that's, you just have to deal with that, unfortunately. And then once you set up a My Social Security account, the most important thing is to check your earnings record. All of that money you paid throughout your life, make sure those numbers are correct in the Social Security, system. And if it's wrong, you need to reach out and say, hey, 2 years ago, I made, $50,000 and it shows 0. And then, oh, okay, we need to fix that. And they'll check in this thing called the suspense file, or you might have to provide your wages or your W-2s or something, and then you'll get that fixed. And a lot of people forget doing that. And one of the reasons they forget doing that is because they think that, their Social Security is determined by their last, year, 2 years, or 5 years, or 10 years. No. Social Security determines your benefit amount by your high 35 years of earnings. So don't forget those early earnings, that you did. And don't ignore the amounts. And because you'll say, well, and in 1980 I made $20,000, but last year I made $100,000. Well, your benefits are indexed for a wage index. So the $20,000 you made in 1980 might be worth $120,000. So it might be more than you were in last year. So don't forget about that too. So make sure you paid into it. You make sure that you get your benefits, what you paid. Wild Bill. I try to catch the live feed, but I'm on the road, living in my truck until I find a place to live. Wow. I'm camping in our national public lands for now, at least until they sell it off. Yeah, in this big billionaire bill, they're looking about selling off a whole bunch of public lands. So, wow, sleeping in your truck. Hopefully it's a big cab over, or, one of those big giant ones. My father was a Teamster for all his life, drove a 18-wheeler. So hopefully yours is nice setup. I have an Advantage plan as well as TRICARE for life. Ooh. My doctor joined a concierge practice. If I drop my Part B, would this be a wise decision? If I need to pick up Part B up later, would there be a penalty? TRICARE for life, they mandate you to have Part B. Not sure why you got an Advantage plan, but if you want it, then because you have Medicare Part A, Part B, and then, all Veterans Affairs, offices, hospitals, they're really, really good at prescription drugs because they're allowed to negotiate prescription drugs, and us, Medicare, not so much. They just passed that. They're working on that, but I think the current administration is trying to roll that back to, to appeal to big pharmaceutical companies. But no, you don't want to drop Part B. If you do, then TRICARE might drop you. So I would reach out to TRICARE, but I'm almost sure TRICARE, changes all the time, but I'm almost sure you have to keep Part B. So, Ron, you are so important with your knowledge. Thank you. You're welcome. Thank you very much. I appreciate it. Asking about penalties if you have insurance from previous employer and don't want to pay Part B now. If I do later, will I be penalized? Okay, Julie, what's up? Okay, if you have insurance from a previous employer, that means you're not currently working. So that is not creditable coverage. In order to avoid Part B penalties, you have to receive health insurance from current work, your current work or your spouse's current work, and that company has to have at least 20 employees. But you said the word previous employer, so that's, maybe a retirement plan or a retirement health insurance or something like that. So if you don't sign up for Part B and you change your mind, you don't sign up for Part B because you like your retirement health insurance, okay, fine, more power to you. But if something happens to that employer retirement health insurance, like the CEO takes all the money and heads off to the Cayman Islands, then you're going to go and try to sign up for Part B, and you will be penalized. 10% for every 12 months you did not have Part B, didn't have creditable coverage, and a retirement is not creditable coverage. So, all right, let's see. My husband is on disability. He has MS. Oh gosh, he is 4 years younger than me. And can I collect on his disability? My Social Security is only going to be about $300. He gets $27.17. Yes, once you turn 62 in November. So in November or December, depends on what day of the month you were born in November. Yes, you can collect benefits on his record because he is receiving disability benefits. He has to at least he has to be receiving retirement or at 62 or disability benefits, and you have to be at least 62. So you have to file for benefits on your own record. So you go ahead and file for benefits on your own record and get the, $300 or whatever the case may be. And then you go ahead and file for a spouse claim on his record. And then, have him there or something. Unless when he applied, if he put you down if he put it down that you were married, then they should just be able to use that. If he's not able to speak or something like that. But when you file next year, he's there, and they say, hey, I just need to confirm that, you're still married to this young man, and you hand the phone to him, and he gives his personal information to confirm he's actually that person, and you probably won't even need to provide a marriage certificate or something like that. So, Vanessa, I'm trying to cheer myself up. Yeah, you and everybody else. This is definitely one of those days. Yeah, we have to be positive, right? Well, maybe angry. Was with my husband for 40 happy years. Wow, I like that. But he developed early onset dementia. Now he's in a memory facility for which I paid $9,000 per month. Ouch. Because no insurance covers mental health issues. Yeah, they're supposed to. That's one of the things about the Affordable Care Act. They ended the whole pre-existing conditions BS, for health insurance, not for Medicare supplements. But anyway, and another thing is they were supposed to treat, mental health issues the same as physical health issues. But I'm sure, theoretically that's what they were supposed to do. But wow. The option people do is when they're in your situation and they, just can't do it anymore, they run out of money, then you apply for Medicaid from the state, and then the Medicaid takes over and starts paying for that facility. Hopefully, if Medicaid is still around, it still has the money, they cover that facility, whatever the case may be. So yeah, make sure you reach out to your politician and make sure this, yeah. X past March 31st was not getting benefits. Now they are saying it could take up to 3, 6, 9 months to get his Social Security checks. Yeah. So this is a surviving spouse claim, and you are at least 60 years old, unless you're disabled. Disabled widowers can get what's called disabled widows benefits from 50 to 59 on another person's record, the deceased's record. But 3, 6, 9 months. Yeah, that's in your particular office. Maybe, a lot of people don't understand that offices, Social Security offices, there's over 1,200 Social Security offices throughout the country. And they're broken up into the staff. There's, as I mentioned, the people at the front windows, the generalists, customer service representatives. But then the people that actually take the claims, there's 2 types. There's Title 16 and Title II. I was a Title II CS, a Title II claim specialist, who I adjudicated claims for Title II of the Social Security Act, retirement, survivors, Medicare, spouse benefits, independently entitled divorce spouse benefits, child and care benefits, child benefits, and stuff like that. Title 16 does the SSI, is the Supplemental Security Income, which is a welfare-based program the Social Security administers. So in your particular office, you're like, oh, it's open, everything is good, and I guess Doge didn't close it down, but maybe in your office there were maybe like 4 Title II people that did what you're asking them, and all of them were kicked out of the agency, vacated from the agency. So maybe they just don't have people in your office, so they need to find somewhere in the area, another Social Security office, for someone to, take over that workload. But yeah, 3 to 6 to 9 months, I could understand if they said 9 months and it's a disability, but if they say 3 months, that's not a disability. You're just looking for a surviving spouse claim, and it shouldn't take 3, 6, 9 months. I've done hundreds of thousands of surviving spouse claims, and if you have the documentation, if it's divorce, marriage certificate and divorce decree, or marriage certificate if it's a surviving spouse, and the death certificate that showed you were, then by the time you walked in the office, you had all the documentation, everything was good. By the time you walked out of the office, I had already pushed the button and adjudicated your claim and went on to my next appointment. That's how it should happen. But it's not, because politicians don't want you to be happy with Social Security. So, because they want to give it over to their buddies on Wall Street. So that is unfortunately the reality, and even more so today. So, all right, we are over an hour, and sorry if I missed your question. Remember, go onto my website, mygovexpert.com, click on the little icon in the bottom left, record a video. It's better if you do it on your phone, because the audio and the video is better when you do it on your phone. So do it on your phone, but if not, on your laptop, that's fine too. And if you've got any questions, longer questions, ask it there, and I will answer it tomorrow, the next day. If you're watching this in a recording, then join my live Q&A. Share, like, subscribe, do all that kind of stuff. And please, please, please